Thank you for joining me. Today, we're going to be talking about how medications help or hurt in mental health treatment. What is medication even good for? Today, we're going to talk about the good, the bad, and the ugly. I'm going to give a little bit of a heads up, a little bit of a disclaimer. I am not a psychiatrist. I am a therapist, though. I'm someone who takes medication, and I've seen it over the years of my practice, how medication has been incredible, how it's been terrible, in some cases life-saving, and in some cases absolutely useless. And in a small minority, it's been used as an excuse for poor behavior. So let's go over some of the basics of medications. Let's talk about some of the differences, because that has an impact on what you take. There's the low-level medications. These are the ones with not a very high risk of abuse, and they don't have super significant impacts. A lot of these medications you'll just get up front at a general practitioner or a primary care physician. Nurses will even prescribe these if necessary. So these medications, typically in therapy, we see as an adjunct or an add-on. We don't consider them to be the most significant thing in the world, although they can have quite an impact on someone if we're not paying attention. Typically with these basic low-level drugs, if you take too much of them, your liver will hate you, but you're not going to overdose or anything like that. The second type of medication are the emergency medications. You'll see these a lot for panic attacks. In some cases, they're overglorified Benadryl tablets. But these medications are used as needed. They are not the things that you would take on any regular basis, something that you would keep maybe one or two of on your person at most. The last category is going to be the strong stuff. These are the things that will really, really affect you, your body function, brain function, your stomach, all those things. For significant severe mental illness, think schizophrenia, bipolar. That's the type of medication we're talking about here. A really common one is lithium. If you've never taken that medication, never needed to, you will be thankful. That's a pretty strong one. So that's the kind of medication we're talking about with the strong stuff. They have significant side effects. We're talking about weight gain, feeling numb or lost. Some people can even become disoriented or derealized. These are the ones that when you give them to people, you have to be very mindful, and they're a sledgehammer. They tend to take out a whole bunch of stuff at once. It comes with some good or bad things, and typically they're only prescribed when there's a significant issue. Other examples of this can be stimulants, which are commonly prescribed for ADD, ADHD. I'm going to come back to that because that one's always confused me, why that's handed out like candy. We're also talking about things like Xanax or all of those other things that could be abused. The medications that you find that are for mental health, but you see used recreationally, crushed, snorted, in some severe cases injected, but just taken when you're not supposed to and you get a euphoric effect out of, those are some of the significant ones. Other strong medications, if you take too much, you're just not going to be present. It's really bad for you, but you're not going to get high or anything. All right, so let's talk about when all of this helps. When does mental health medication actually make a difference? If you've never taken medication to a significant degree, it's going to be important for you to understand just how significant medication can be for certain people. I think schizophrenia is a great example. I've talked about schizophrenia multiple times on this podcast. I think it is a very great representation of what mental health disorders are that don't have to include trauma or stress in order to activate. So schizophrenia, if you've never seen it play out in front of you, is incredibly wild. It's seeing, hearing, feeling things, people, ideas, entities that are not actually present. They become incredibly disorganized, those with schizophrenia, and are hard to understand, but seem rather confident in what they're talking about. For high-level medications, the strong stuff, for something like schizophrenia, that's how you help it. You can't talk therapy out of schizophrenia. You can't emotionally regulate out of it. That medication, that sledgehammer I was talking about, is what's needed so you can actually be connected to the world. These are great medications and a gold standard for a lot of things that are needed. Also, severe bipolar disorder. You cannot deep breathe out of bipolar disorder. You cannot self-affirm. You can't do any of that in bipolar disorder. It's not going to work. Medications can help you balance. And granted, if we're not talking about trauma responses, we're strictly talking about neurochemicals that are misaligned, medication's a great option. Okay, so those are for the severe ones. For the less severe mental health issues, when does this help? Whenever medications give you a chance at recovery from whatever you're dealing with, mental health or substance abuse, or they give you a chance to do work, that's when I think that medications are most needed. A lot of times people will go into mental health facilities and they'll be completely drained. They won't be able to function properly, and they'll really struggle to be able to be present. In those cases, having medications that reduce anxiety can be beneficial, not to, numb somebody out of what is needed, but when you're at a facility, you're only there for so long. And if you're insanely anxious the whole time, you won't get much out of it. So some medications can be utilitarian in that sense that, well, while you're here, let's make sure it's worth it, especially if you're paying out of pocket, because that stuff gets wild. So getting a chance at all of this is really important. I've seen this a lot in rehab facilities. Somebody comes in off the street and they go through the withdrawal symptoms and they're panicked, they're overwhelmed, their stomach's in knots, whatever it is. And then they get sober and they realize the wreckage that they've left behind, and they're on the verge of a nervous breakdown. Do we give them Xanax? Please, I hope not. If there's a facility handing out Xanax to people who are trying to get off of drugs, they need to readjust that. But if someone's coming into rehab and they have to deal with everything that's left behind that they were too high to realize, I can understand, okay? Medication should be a way to get your feet underneath you. This is not to fix your problems. When medication can give you the opportunity to do something, that's where I think a lot of the benefit is, especially when you can allow for functioning. Medication should not be a cure-all. Okay, even for something like schizophrenia, it's not a cure-all. Something like lithium is not a cure-all. It simply takes the symptoms away, but we still have to deal with disorganization, lack of social groups, family stress, okay? So medication is not a magic bullet. However, if there's a low level of medication that allows someone to function well, that's great. Again, I only think medication should be used as it allows for functioning, as it allows you to get your feet underneath you. One thing that's incredibly important in the mental health sphere is getting on medication that can be readily adjusted. If you are taking a medication that takes a significant amount of time to detox off of or work from, then you shouldn't take it lightly. If you are considering medication, talk to your doctor about the side effects of it and how difficult it is to start and get off of, because that can give you some sort of an idea of how it works, okay? So best medications are the ones that require the least amount of work to have an effect, and it gives you a chance to do something. It doesn't fix everything, but it gives you a chance to do something. Let's talk about when it hurts. Okay, I'm very, very tired as a therapist of hearing how medication can be a cure for something. We talk about pharmacy, big pharma, medication, and now for some reason, mushrooms are being thrown out there as a cure. Please don't take mushrooms for your anxiety or depression. It can lead to psychosis and self-selection bias. So just don't, okay? But medications, when they're supposedly used as a cure, never work that way. If someone has that expectation, they will be sorely disappointed. Medication can also be a huge problem if it numbs someone out from the human experience. This is incredibly important when someone's looking at the wreckage that they've caused. And let's say their quote unquote symptom is anxiety. Well, you know what? If you've ruined entire family systems and you've caused trauma that lasts someone's lifetime, you should feel anxious. That's not a symptom, that's a consequence. Okay? If you're feeling anxiety because of the things that you've done, or you're feeling depressed because of the ways that you've affected people, sorry, that's humanity. You should feel that. And medication should not be used to take that stuff away. Because here's the thing. Your anxiety and depression is warranted and it is needed for change. Also, the people that you've affected through anxiety or depression or addiction or whatever it is, they deserve to have you experience that. Because in shared humanity, we need to see that other people care and are affected, not in some narcissistic way, but to see that reciprocal relationship exists. So if you have come to your senses, you have gotten sober, or you are looking around and seeing how much you've affected people, you shouldn't take medication to feel less anxious. You should feel anxious, and that should push you towards change. That is a huge issue in therapy. And something that I see all of the time is that people show up to therapy, they start to feel a little better. Sometimes they decide to go get medication on their own. And about halfway through the therapeutic process, they start opting out of emotional involvement. Why? Because they feel better. Now, that might sound like a little controversial to be upset about. I'm going to be upset about it for as long as I want, because it's starting to get annoying over the years to see someone walk in and tell me I'll do whatever it takes to save my marriage. I'll do whatever it takes so that I don't do this again. And we get a few months in and they feel a little better. They take a little medication and then they say, well, I feel better. I don't really need this anymore. That makes me wonder if you ever needed it in the first place, or if you just didn't want to feel bad about things. So if you are using medication to excuse poor behavior, in order to not feel the effects of the things that you have done, don't take medication. It's an excuse. If you are doing it to numb away feelings intentionally, you shouldn't be taking medication. You should be getting some accountability. One of the other ways that this hurts, and not at the fault of the person when medication isn't helpful, is when it has an unintended side effect that someone's not aware of. Sometimes people can numb themselves out because they assume that's what other people feel. Maybe they have experienced such high emotion that they've come to expect that that's what everybody should feel, right? Everybody feels numb. They don't feel what I feel. And because of their lack of perspective, they numb out. And they're unable to engage with the world around them. That is also not helpful. Medication also very much hurts when you don't take it properly. Do not come to therapy. Do not talk to your family members or friends and tell them that your medication isn't working if you are not taking it as prescribed. For the vast majority of medications, if you don't take them as prescribed, they don't work. I'm going to throw a little side point in here. It isn't in my notes, but it's my podcast, so I'll just talk about whatever I want to. If you're taking medications, or you're considering you should take medications, please be honest with your doctor about what you're using recreationally and how much you're drinking. Here's one thing that I think has blown so many clients' minds in my office and hopefully offices across the country. If you are smoking weed, if you're using a card or a pen for that, it can turn off your mental health medication. It's a vast, it's a vast understating of what actually happens. The mode that it affects in the brain is incredibly complex. Here's the thing, though. It affects the neurotransmitters in the brain. And so when someone comes to me and says, yes, I'm smoking weed. Yes, I'm taking depression medication. Why am I still depressed? Because you're smoking weed. And it's affecting your medication, making it utterly useless to take it in the first place. So if you are considering medication, or you're wondering how your medication is affecting you, you have to be honest about what you're taking, because it might be counteracting it. So taking medication can have a quote unquote negative effect because people assume that it doesn't work for them. when in reality, they're undercutting the entire process. How can we use medication properly? 1, please talk to a psychiatrist and make sure the meeting lasts longer than 15 minutes. Okay? You are paying for this psychiatrist's time. Ask questions. I recommend for clients that want to schedule a session with me, as well as if they want to talk to a doctor about anything, come in with a list of questions. What does this medication do? How long does it take to start? What kind of side effects could happen? Is there any sort of testing that I could see of what would be most effective for me? Talk to them. I'm a therapist. I can give you sort of an idea of what works, but I'm not a prescriber. Can't help you with that. Another thing to consider about using medication properly, you need to start low unless there's a significant issue. I always recommend starting at minimal doses, as is recommended, obviously, so that you can work your way up and you don't start swinging for the fences, feel nothing, and assume that means you're feeling better. I mentioned earlier on in this episode about stimulants with ADD and ADHD. I do not think it's a great idea to give, especially a child, stimulants for ADD or ADHD as a first option. Why? Well, we have other medications that are non-stimulants, non-addictive. They have much less side effects, and they're safer. Why on earth would you use a stimulant if you could help it? You know, we've got entire generations of kids that have gotten stimulants all throughout their childhood and their adulthood, and I don't even know how much that's affected the brain. I mean, some people go on the conspiracy theory route where stimulant medications are methamphetamine salt technically. So are you just microdosing meth to make your ADHD feel better? I don't know. I'm not a chemist, but you shouldn't take stimulants just because you can't focus. Try something else first. Is there a medical use to it? Oh, absolutely. There's plenty of clients that I've seen and people that I've known that have taken stimulants and do it well. Okay? However, you need to be careful. People do abuse those. People take them when they don't need them. You have to be very careful about what you mean when you say that you cannot focus. What some people mean by they can't focus is they're not as focused as they would want to be. That's not ADD, ADHD. When you cannot focus on executive functioning tasks, that's where you see true ADD, ADHD more. If you're a college student that has to push a finals paper through and you cannot sit down and do it, that's probably not ADD, ADHD. It's probably anxiety. But a stimulant will help you finish it. Yeah, because you're microdosing and then you feel more energized and so you do it. Okay? This is what I mean by you have to know what the medications do. Talk to your doctor. Because some people will assume that medications have helped when they've really treated something different, and then they misunderstand what's happening inside of them, and they treat themselves incorrectly for the rest of their lives. I talked about starting low in medication. Again, if there's not a serious concern, always do that. Why? You might need less than you think. I said at the beginning of this episode that I'd take medications. On one medication that I take, I'm on one of the lowest doses possible. On one, I'm on the highest dose possible. Why is that? Is that because I'm just some level of crazy? Well, one, that depends on who you ask. It's actually because our brain responds differently to different medications. And sometimes you need different doses. Sometimes you start the lowest dose and it hits you like a truck. Great. You're on the lowest one. You can decide whether you want to continue that or something else. If you start on a medium or high dose, you're going to have to adjust from there, and you might make yourself feel better without actually being better. Start low. Research medications. Research what the side effects could be, what the usefulness is. And also remember, you do not have to take medication indefinitely. Save for some of those really significant and severe things. You don't have to be on medication for the rest of your life. Diagnoses don't even have to apply to you for the rest of your life. If someone is on, let's say, depression medication, and they feel better after a few months and stop taking it, great. Don't take it again unless you need it. You don't have to be on medication for the rest of your life. In fact, if I could get off of it, I would be thrilled. I also wouldn't know what day it was, and I wouldn't be able to be at a high-functioning job. So I've accepted that I'm going to probably have to take it until I die. It sucks, but my brain doesn't like me very much, and I got to balance it out somehow. You should also consider when you're taking medication, are there other things that you can do? If you're feeling depressed, your first instinct should not be medication. Your first instinct should be, how are you treating yourself, both physically and emotionally? If you sit in a dark room for 14 hours a day and don't talk to anyone and refuse to go outside or do anything productive, don't tell me you're depressed. Now, I'm not shaming people who are depressed. What I am saying is, why would you take a medication when you can get the same result from going outside? Again, incredibly reductive, but there's a huge point here. So many people in the modern world have assumed, I have a symptom, that means I need a medication. That is so wrong. Sometimes suffering is a part of the human experience, and we need to do it to be better people. Sometimes we look upon our decision of healing and wonder, what would be better? To suffer for a few weeks into getting into a new schedule, or taking a medication and feeling better immediately? Most people, if they were in front of a big audience, would pick option number one, obviously. But behind closed doors, they're going to pick number two. Here's the thing. You don't grow that much just by taking symptoms away. Life doesn't become fulfilling, it just becomes tolerable. You become a better person by struggling towards healing instead of just gaining it. Let's say this in a slightly different way. When you suffer and overcome, you find more fulfillment than you do by taking a medication that numbs the human experience. I am an advocate of medication. I'm also an advocate of going outside. You can do both, okay? And I know that I could anger so many people on so many sides of every aisle with this, but sometimes people need to go outside. Sometimes people need to stop assuming that the best community they'll get is online, or that somehow social media can tell them who they are as a person. For many people, they just need to form healthy relationships. Go risk something. Go be vulnerable. You don't have depression. You're just isolated and alone. You don't have to be. But for some people, there is a chemical imbalance. For some people, it doesn't matter how much that they do. Because I've tried all these different coping skills. I've tried all these different social things. It helped, but it didn't get me over the edge to where I could be functional. I did all of that. I found medication that worked for me. And the way that it worked was by giving me a chance to do work, by giving me the opportunity to suffer well and find growth. If you've been listening to this whole podcast, you've gotten to this point, that is really what I want you to take home, that if you can improve your life by practical things, by what you're eating, how you engage with the world, who you're talking to, what your thoughts or expectations of yourself is, if you can change your anxiety, depression, whatever it is through that, do it. If you have trauma, and that's the source of these emotional issues, go to therapy. If you need a little boost for a short period of time, do it well. Don't just do it blindly. Do it well and do it intentionally. If you're someone who might need longer-term medication, it's okay to work up to that point. If you are someone listening who says, something bad is going to happen to me if I don't get stable, okay, I'd rather you be alive and work down than shoot for the lowest dose first and possibly not see you tomorrow. There's a balance in all of this. Please go talk to someone if you are in that realm. But for most of the people listening, we need to treat medication like a tool. If you overuse it, you won't know how to use other ones. Take the time, research things. Make sure you're not running away through a pill bottle and that you're truly engaging with the people around you. Thanks for listening today. I hope you got something useful for yourself or maybe other people. I hope that you follow this podcast so you can get weekly updates on every Tuesday and share it with those who might find it beneficial. If you feel the need, you can leave something in the tip jar to help pay for the production of this podcast. Thank you and have a great day.